Hi, as you can see, I had a little situation here with my arm here. I was wrestling around with my son, who's 180 pounds, in the kitchen, as my wife was telling me not to wrestle in the kitchen. He went back, his head was going to hit the back of the stove. I grabbed him and I braced my left arm as hard as I could, and I just snapped my humerus. Basically, the humerus should be like this. Mine's like that. So I went to the ER, went through a lot of extreme pain. Now I have a lot more sympathy for people who are in severe pain, because that was the most excruciating pain I've ever felt in my life. And now I know what my wife feels like when she said she was pregnant, but probably not to that degree. But anyway, I went to the ER, it was fractured. So then now I had to wait over the weekend to get surgery, which I was not excited about. But I had to get a plate on my shoulder that went from here to here, because the rotator cuffs also detached from the bone, and they had to nail those back somehow. So they have screws and bolts and all sorts of things in there. So on Monday morning, I went in at 8 o'clock, and I finally got in to the surgery at 12. So here's another interesting experience. I hate waiting in doctor's offices. So now I'm on the other end. I'm the guy waiting, and so now I'm never going to let any patients wait, because I've done that in the past. So I'm definitely learning some interesting experiences here. But so what happened was we went into surgery, and it was like a minute later I was just waking up, and I look at the clock and it was 3 hours later. So it went really fast. So I was happy about that. But as my wife took me home, my blood pressure was really low. So I got home, went to bed, and I just could not urinate, which is one of the side effects of the medication. I was heavily drugged. So about 3 o'clock in the morning, I had enough. I told my wife, take me to the ER right now, because I haven't gone to the bathroom. So all that toxic waste in your body. So I went to back to the hospital, waited an hour, and they evaluated me, and they said, well, we're going to put a full catheterization in you. And I'm like, what is that? They go, oh, don't worry about it. It's just going to be some slight pressure. That was another painful experience. So they took out 1 liter of fluid from my body, which was pleasurable to get that out. But then I had this thing inside me that was even more uncomfortable, because they taped this bag to my leg, which I was walking out of there going, this is not going to work. So I had them retake it out. And I said, just let me go home. I just want to go home. So I go home, and give me all these drugs to take. And they were like saying, yeah, you have to take these drugs. But I remembered there was a remedy that I used on some patients in the past called chlorophyll pearls, which is this thing right here. Chlorophyll is like liquid, like the blood of the plant. It's like liquid sunshine. It detoxifies the things that cause pain at the nerve endings. So as soon as I got that in my body, like the pain just went right away. So I really have not taken any medication. So it's been 2 days after the surgery, and I have no pain in my arm at all. So it's healing fast. I'm doing the acupressure on it. So I will keep you updated on how things go. But this was definitely an interesting experience that I don't want to experience ever again. Talk to you later.